Hi everyone, my name is Diego Fernando Show Morales. I'm a French and Spanish student in the Global Health track from the MINT program here at the Institute. I come from Madrid, where originally I studied a dual degree in laws and international relations, so I didn't have much link with global health before coming to the Institute. So in my view, global health is the intersection of all the professions that help in the promotion, education and management of health at a global level, but also at a regional and national level, which I think is very interesting to study because you have a wide array and a big range of professions that are covered by this term of global health. And to look at how all of these work together and how this encompasses pretty much the term global health. So personally, as I said before, I didn't have a connection to global health in my past studies, and what attracted me the most to the global health program at the Geneva Graduate Institute was the possibility to be able to touch global health in the MINT program, but also to be able to touch subjects from other tracks if we wanted to, which are very enriching, so you can create your own curriculum. Also, you have people that come from professionally and culturally distinct backgrounds, which also enriches always the conversation and the debates that you might have, and even can push you to have new ideas or to see things newly and together in a different ways. And also beyond that, at the Institute we have the opportunity to have the research centers. So for instance, there's a Global Health Research Center where you can see research that is related to global health, but maybe you don't study every day in class, like access to medicine. And that also shows you what it can be to work in global health directly, or also to even get a professional experience already while being a student within the field of global health. What makes studying in Geneva exceptional, I think, is the fact that Geneva originally, historically, is a point of passage for many cultures and a point of intersection, and that hasn't changed today. You can see it a lot through the establishment of all these international organizations and NGOs that are around here. And today, after a year that I've been here, there's always different events and different conferences that are happening, which always you can sign up to and you can go see. So if there's topics that interest you, that can always push you to network and also push your professional endeavors in general, even consider new things, new topics. So I think that's something that is very unique to Geneva and that you don't have everywhere. So as I previously mentioned, I don't come from a global health background originally, and I think it wasn't necessary to apply to this program to have this global health background. I think you gain it through the experience and you learn a lot through this. Also having this interdisciplinary approach where you can take subjects from other tracks can also be kind of a safety net when you come to global health if you're not so sure that you maybe want to develop yourself in that field. For me personally, I was already interested in global health, so it was very enriching for me to be able to choose this program, and it was an added value that I didn't see in other master's programs in international development, the fact of having this track and to be able to specialize but still being able to keep a foot outside this area if you wanted to. The most memorable experiences that I've had so far at the Institute, I think one of them is clearly the Applied Research Project. So through the Applied Research Project, I had the opportunity to work with an NGO that is based in Togo, and I had the opportunity to go 2 weeks with my team to Togo and to experience and do some research on the impact of the organization's activity in terms of health in the rural societies of Togo, which was very interesting. Beyond that, I think that also through our classes and through the professors we have, we can see the clear network, and we can have access to, for example, guest lecturers that can come from different organizations. So for instance, I had the opportunity to have some lectures with persons from MSF, so Médecins Sans Frontières, but also from the UNAIDS or from WHO and Gavi, which I think is very interesting and also very enriching to have different perspectives on the same subject by all these people. And beyond that, I also had the opportunity to join the Global Health Initiative, where I'm acting as communications director, and where we are putting forward a lot of events and a lot of things that we think we would have liked to see the past year as global health students, and we plan to give that to the future students. In my view, if I was a prospective student, I think something that I would really like to know and that would push me towards applying to the global health track of the Graduate Institute is the fact that you have to take every opportunity and that you have the chance to be surrounded by people from diverse cultural, professional backgrounds, but also that you have all these international organizations that are here. You have this array of very good professors that come from also different backgrounds that are going to really enrich your program and your experience, and the fact that you can always kind of assemble your own curriculum through the elective subjects is also a help to be able to really specialize and professionalize your program towards one aspect or another that you might be more interested into.